My name is Jessica, and I am Hendrix's maternal grandmother. And this is Hendrix. She will be 5 years old on Thursday, 4 years post-injury. And Hendrix's mother is my daughter, the only child that I have and the only granddaughter that I have. And Hendrix was born in Seton Northwest Hospital here in Austin, June 18th, 2015, perfectly healthy. No challenges, developing appropriately the first 12 months of her life. She was very happy baby, very easy, laid back, just acceptance and tolerance. She was just a beautiful child, and she loves music, and she would dance, and she was just on the verge of walking, like she was walking around holding on to my bed with just one hand. The Thursday I saw her before her birthday, before this happened. And my daughter was living with us, and she was pretty involved, but she was going to art school to be an electronic engineer, and she was working to become a body piercer through Atomic Ink. And so she was pretty busy and a lot of trauma she dealt with before this. And so when this happened, it was just added on top of other stuff. So that's just kind of why she's not here with us. She does visit, she does call, she does text, she does ask, she goes when she's in the hospital, et cetera, et cetera. So she's involved, but just from a distance, working on her own trauma. But yeah, Hendrix was born happy, and she was born fine. She left on a Thursday to go spend the weekend away from home and with her biological sperm donor and his now new girlfriend, his new relationship.
Okay.
So, he got her on the weekends. That was their agreement as parents. However, it started in late January of 2016, early February, where she was beginning to come home with marks on her body from visiting him and this woman.
And she wasn't quite a year old at this time.
Right, exactly.
Okay.
My daughter and him separated in October of 2015 after she was born.
Okay.
They were all living with me. I'm like, hey, come stay with me. I'm grandma, I'll help you guys. They were both in school. They were both working. Like, they had goals they were trying to get. And I was a single mom, so I was like, hey, I'll help you. He moves out. He has a new girlfriend. So now we're going to letting her go on the weekends with her and him.
Okay.
Back to January, February, when she was having weekends away with him and the girlfriend, she would come home with marks, and I would be like, hey, what is this? Asking my daughter and him. And they always, more him than my daughter because she wasn't there. But she would be like, yeah, I'm asking about it. I don't understand it. Then he made it seem like we were being hypersensitive because she was beginning to walk. And so she was falling and having accidents as she's learning.
Okay.
That was a scratch. That was, she was playing with another kid and a toy, excuse after excuse, until February she came home with a adult handprint on her side of her face, like a bruise, and it wasn't going away. So it wasn't just a quick tap, light tap, like it was lasting. So I was irate. I let them know, hey, I'm taking her to a doctor. I don't feel comfortable with your excuses, and if I'm being hypersensitive, I would rather be called that than not. So I took her to an urgent care clinic, and that physician says, I have to call it in. So I'm fine with that. But she also said, well, maybe she has a bleeding disorder because she had bruised easily.
Okay.
So,
Right.
so we looked at that avenue too. Like, we wanted to be fair and not accuse someone who was innocent, right? Like,
Absolutely.
that's what we're trying to do here. So we looked into that by taking a appointment with hematology and getting a lot of blood work done, but also reporting it introduced CPS. CPS quickly said, go to Dell, do your abuse exam there, and we'll meet you there. That's where they interviewed all of the three of us, my daughter, him, and myself. The girlfriend was not there.
Okay.
CPS had interviewed us, drug tested us, and said, okay, well, sir, you cannot be anywhere near her for the next 90 days while we investigate. They looked at my daughter and said, your drug test came positive for marijuana, so you're not allowed to be alone with her. And Grandma, you're gonna be the supervisor. So I'm like, okay, yeah, whatever. I don't disagree with how you're treating my daughter, but I need to follow the system's rules. I don't think she should have been punished because she was smoking marijuana, and most of the world it's legal. So anyways, the 90 days went by, and this is with Williamson County CPS, and I never once had them come to my home to explore her living environment. And from what I understand, she didn't go to look at his living environment either. And when the days were over, they just said, we find no reason to believe he's harming her. You need to return back to normal. So that's when I started investigating, like, what rights do I have as her grandmother to up and advocate for her to not go. Like, I was still uncomfortable. And I even talked to a police officer, and he says, you have no grandparent rights. It's the mom and him. That's it. What you say doesn't go. So I couldn't protest her returning to weekend visits. And I had to go. So that's February, March, April, May. So mid-May, she starts going back for 1 or 2 weekends. And I don't remember if it was like the 3rd or 4th, but it wasn't very far. That's when she has an incident and is very badly hurt to where she is almost dying. Yeah. So they called the ambulance. The ambulance came, placed her on life support as best they could, and transported her to Dell. And then she was at Dell in a coma, enduring several brain surgeries, multiple bone fractures, lacerated liver. The Dr. Liker at Dell, who is the CP or child abuse specialist, reviewed her case and said that it appears she had endured severe blunt force trauma to the head, and that she was beat for days by the age of the fractures, and how they looked to her is how she explained it to me. So that I saw her on Thursday, and she went to the hospital like 1 a.m. Sunday morning.
Okay.
So between that time, she suffered a lot of severe physical abuse. And they told me when we got to Dell, they said, to my daughter and I, you are going to have to be prepared to lose her. They didn't think she would survive. So we call family and we let them know, would you like to meet your relative who you've never met before and is about to pass away? It was very difficult. My daughter was there. My dad came from Arizona. My brother came from California. My mother came from Kansas. And I had, like a few other family members, my cousin and my aunt from Illinois came to say goodbye and to meet her for the first time. Well, while they were here, we learned that she suffered 2 strokes.
Okay.
And developed a DVT in her right thigh from a central line or a main line. So she had to have a blood transfusion, and now we're looking at someone surviving a stroke, which means the left-sided hemiparesis and visual loss. She had to get a G-tube, and she was there at Dell for 3 months.
Wow.
She proved to them she wasn't passing away.
No, she's a little fighter.
Yes, ma'am. She is
Wow.
very. I had never missed a day by her bedside. I would read to her, sing to her, play music, do essential oil therapies, and I'm just trying everything I can to help heal her brain while she's sitting there in the coma. Wow. And the spinal fluid is just falling out of her like a waterfall. But she survived, and then they said, well, she may be a vegetable. She has so severe brain damage. The whole right side is what they said blackened out.
Okay.
So if you were to look at an MRI, it would be the whole right side of the brain is pure black, like it's not existent. Gosh. So I was prepared and I said, okay, I understand. Let's go to therapy for the stroke. It took a little begging, but Dell's therapy let her come in and started working on her recovery, and she hasn't stopped therapy since.
Wow.
I'm known as the therapy Nazi.
Hey, you're her advocate. You got to do what you got to do.
Yeah. And people appreciate that. They know that I don't mean out of ill heart. I'm just a strong advocate. And the reason why I advocate so hard is because I can see that she wants it. Like, it's so clear that she wants to learn and she wants to walk and she wants everything in therapy she loves. And we also incorporated music therapist into her program because we are a musical family. So she loves her music very much.
Oh, so what kind of music is her favorite?
Her signature at Dale Hospital is Bob Marley.
Oh, nice. Good choice, Henny.
Yeah. My song that I sing to her and my daughter they're both grown up, is Three Little Birds.
Aww.
Yeah. So we would Bob Marley every day. She would wake up, and then in the evening we're playing the Mozart effect music that helps healing the brain and certain sound waves, hertz,
okay.
to be brain repair. So I would play those at night and then burn a diffuser. So everybody was like, go into Henny's room. It smells good. It's so relaxing.
Right. It's like a little spa in Henny's room. That's really cute.
And the janitorial staff and doctors, et cetera, would know her as the Bob Marley girl.
Aww.
So
cute.
She loves Bob Marley. She's always been a mature music listener, not really into the kid stuff.
Okay. You lucked out on that one.
Yeah. Like what's her name? Lizzo.
Uh-huh.
She likes Lizzo, and she likes Cardi B. Maybe her voice.
The fun stuff.
Yeah, very interesting, as well as like Metallica, and she's just all across the board.
She appreciates all music. That's so cute.
Yes,
Well, I see
ma'am.
she's got lots of books there. So she likes to read.
She is obsessed with books.
Oh, books are so great.
What did you say? I'm sorry.
Yeah, I kind of cut out. I was just saying books are so great for all special needs because, you can read to them if they can't read. They can read to you if it's possible. Just look at pictures together. And they're such a great thing for all kids. I'm a huge book fan. So I love seeing that she's looking at all her little books.
Thank you. I love that she loves books, but when she's left alone with them, she destroys them.
That does happen.
So we still have to do cardboard books and kind of do it together. But she really just enjoys turning the pages.
Yeah.
Being in control of something, doing something independently. Yeah, so we spent, back to my story of when we were in the hospital, we spent 3 months there at Dell. And we also, like I said, had time in the rehab. And I just want to say there are some phenomenal people in that building.
They really are. I couldn't agree more with you. Absolutely.
Oh, I feel like I can't say it enough.
Yeah.
Some amazing physicians. If I may name a few, Nicole Botham in rehab has been a huge advocate and voice for Hendrix, and her team of therapists have been phenomenal. Not to mention our nurse practitioner with Comprehensive Care Clinic, Jennifer Murray, is amazing. Mm-hmm. I would do anything with her and not ask questions. And mostly the biggest thing that has been hard for me to process is the tragic loss of Dr. Timothy George, who was Hendrix's neurosurgeon and performed surgeries that I cannot even explain. He thought above and beyond and saved her life, but saved her life, if that makes sense. Like, he thought, how can I protect her future the best way I can with this surgery? He didn't just perform emergency surgery. So when we lost him, it was very emotional. And he was a very loved man.
He was an amazing surgeon, amazing advocate for these kids. And yeah, he was loved by all of his patients and everybody that knew him. So yeah, he was definitely a huge loss to the community. I mean, not just the local community, but really the entire community. He was an amazing man. He really was.
Had his hands in a lot of stuff I learned at his funeral service. So yeah, he was a huge part of the community in many ways. So wow. It was amazing. At his service, they had to open up a second building to seat people. So
that
it was
a lot, doesn't it? Yeah, it does a lot about him. Wow. How many surgeries did he end up having to do with you guys?
3 cranial surgeries, along with another brilliant surgeon, Dr. Patrick Combs, who we adore. Okay. They kind of did the cranial surgeries side by side together. And there were 3 different brain surgeries, 2 while in the coma. Wow. We were hard time getting the brain hemorrhage bleeding under control because she has a bleeding disorder. Wow. Where she's really fast. It's called von Willebrand's disease. It's rare, but it does happen. So it was just hard to get it under control, and he did her brain surgeries very different. You know, they normally cut the skull bone and remove the bone and put it in your stomach, right?
Mm-hmm.
And preserve its life while we are allowing the brain to swell and heal. But I think Hendrix was probably the second patient that the surgery has been done this way at Dell, where they go in and they cut a circle, palm-sized circle of the skull, and just put in distractors like lifting wrenches so they could lift that piece up and down to allow it to go without removing it.
Oh, okay. I
Yeah,
don't think I've heard of that yet, so that's really cool.
yeah, I was excited. I was like, wow. And no, what do you want? So you can see she knows words and sign, but we are working with a communication device. This backpack? No. Yeah. I don't know what you want in it, babe. Yeah. Say hi.
Hi, Henny.
Can you say hi? We're talking about you.
No.
Okay, it's charging. Can we wait? Can we look at another book? Yeah. The Grandma Kisses? No. No? You're doing so good being patient with me.
Henny, I heard it's almost your birthday. Is it your birthday in 2 days?
Yes, ma'am. It's your birthday?
Wow, that is so exciting.
And we also are celebrating her survival. You know, she celebrated her strength and her determination and her bravery for surviving. So it's a little emotional during this time of year for the honey.
I get it. Yeah, I get it. Yeah, every birthday is way more than just a birthday. It's a huge take that world. I'm still here and I'm still doing great. Yeah, I get it. Wow.
She came home and she was placed in my care as her legal guardian.
Okay.
And her mom, like I said, is still having a hard time dealing with a lot of the trauma. But she is allowed to be involved, so I just keep her informed and educated, and she comes by every once in a while and is texting and checking on us. So we're giving time to kind of process. Everybody deals with trauma differently, and she was the closest person to this tragedy. Oh, okay. Okay. Can you wait for me? Because you're waiting, you're being such a good girl. We want to tell them how brave you are. Is that okay? Yeah. Yeah?
You are so cute, Henny.
I call her a warrior princess. She's just
That's a good name. Yeah.
She's very sociable, so she's made a lot of heartfelt connections with people over the last 4 years, who just are heartbroken about her story, but turn around and fall in love with her personality and her loving, you know, she's wanting to kiss and hug people and say hi all the time, and, you know, makes people feel noticed, and it's really special. Are you tired? No, you look tired. So I'm not sure what else I need to say. I'm feeling lost at the moment. So
You mind if I ask a couple questions? Yeah. Okay. So I know with COVID, things are kind of crazy right now. And before COVID, did you guys have like nurses that would come to the home to help, or was it just you all the time? Like, do you have any help at home, or is it really just you and Henny?
It is just me and Hendrix,
Wow.
as day-to-day living and assistance. Before COVID, I had a full-time job and was fired because of COVID.
Okay.
So home with her. I've kept her home from daycare because she's immune compromised.
Absolutely. Yeah.
But yes, it is just me. And in the beginning, we had nurses come home with us. Um, how, and those nurses got her to be able to eat by mouth
Wow.
and start to use her voice. So we are so grateful to them. And then I lost services where I had nothing.
Yeah. Unfortunately, that is a story that I've heard way too many times, and it's not right. And I wish that I had a better answer for that. But
It's
wow.
confusing. Like, I've learned how hard I have to fight for her rights.
Yeah, it's a full-time job. It really is. It's a full-time job getting services and trying to manage all of the appointments and all of the therapies and yeah, there's really no time for anything else. It's a lot of work. So I'm yeah, I'm sure she probably tells you in her own way, but I'm sure she appreciates all that you do for her.
She's
You're a
very,
grandma.
but yes, thank you so much. I just don't feel like people are disposable.
They're not. I agree with you. They are not.
A lot of people make comments like, wow, you're so amazing for doing this. And in my mind, I know they're giving me a compliment, but I'm thinking, doesn't everybody? Like,
Yeah, and we all do what we have to do, but you're doing
yeah,
you're doing a lot more than most, and you stepped up. A grandma, you're usually, you've already raised your kids, you've done that, and so you're coming back and doing it again, which that's admirable. So I know it feels weird when people say that, but they mean it.
yeah,
You're really doing an amazing thing.
thank you. I appreciate it. Um, I'm just so discerned and heartbreaking that, what's happening in the world today. And that part of that is disability lives matter too. We are fighting the same fight that Black Lives Matter is fighting for, and I stand up for that tally.
Absolutely.
And Kenny has a double whammy, it's disabled / Black Lives Matter. So
I know, poor thing. Yeah, it's a hard fight, and I'm so glad you're helping her because we all need more people in this battle. And she's an adorable little girl.
thank you.
She looks like she's getting frustrated. I'm just going to ask you a couple more questions, and then I'll let you go because I know she's getting frustrated with being on camera. I'm sorry. I'm going to hurry, Henny. You mentioned that she's eating some by mouth. Is she all by mouth now, or is she still G-tube fed?
She still has a G tube. She is all nutrition by mouth, but the G tube serves as water
Okay.
and medicine. Doesn't drink. She'll aspirate.
Okay. Cool. So after you guys got sent home after 3 months in the hospital, have you had to go back frequently for long hospitalization stays, or yes? Okay. So you guys are frequent flyers.
There now, it's home away from home.
Okay.
Yes, I can say 13 times in the last 4 years.
Okay. So yeah, she has to spend.
And the most recent one was in May.
Okay. Oh wow. So that was very recent. Okay. And you mentioned go ahead.
Because you had to stay in the room.
Yeah.
I couldn't leave. If I left, I couldn't come back.
Yeah, I know COVID has just totally turned everything upside down. I know it's so stressful and just harder on families, and it's already a hard, stressful situation when your kid's in the hospital, and then having all this on top. It's a lot.
Yeah, it was. And I also just wanted to add on about the nursing.
Yeah.
Even though I lost it, I fought to get it back, and I finally got it back. So I have skilled nursing hours and attendant care hours now that I've had to fight for 2.5 years.
Wow, but you finally got him.
Nurse.
Okay.
Like,
Yeah.
there's a nursing shortage in Austin.
There is, and I'll tell you a teeny tiny little good news with that. Because of all the COVID stuff, all of the nurses that just graduated, usually they are trying to get hospital jobs, but the hospital actually isn't hiring a lot of new nurses right now because of COVID. So a lot of those nurses are going into home health. So there will be more nurses. They're coming. Yeah. There is going to be kind of an influx of new nurses coming very soon. Hopefully you'll get a really good one.
I hope so. I hope.
Wow. So one last question, and then I'm going to let you go. If you had one piece of advice for another mom or grandma in your shoes, what would it be?
Scream.
Scream. Okay.
Scream loud as much as you can.
Just let it out. Yeah. That's
that, like everything, but don't shut your mouth is what I'm saying. Advocate, advocate, advocate. Don't give up. Don't let people persuade you into thinking differently than what your intuition feels. You have to fight to get what they deserve, and
wow.
just the fight is hard and it's exhausting and it's infuriating and confusing, and seems like there's a lot of secrets of how to get things. So just keep fighting, keep digging, keep looking, keep asking. Don't stop using your voice, and that includes therapy for yourself.
Yes. Very good tip. Yes, I agree with that too.
Someone to talk to and talk. Don't hold back. Like, let it out.
Awesome.
And you're allowed to feel however you want to feel.
Yes.
Don't take that away from you. Every single emotion you feel is valid. Period.
Absolutely. Absolutely. Thank you so much for sharing your story, and thank you, Hendrix, for putting up with us. I appreciate it. I hope you have a wonderful birthday.
Oh, thank you so much. And I just wanted to say one more thing. We are still fighting for justice.
Yes.
Our system is completely broken, and it's disgusting. They treat people with drug offenses worse than they treat murderers and child abusers and sexual assault abusers. And it's just disgusting. So
I think she gets her justice. She deserves justice, and
I will fight until I can fight. So yes. Thank you for letting me be a part of this.
Yeah, your story's wonderful.
Circle has done for our community. You guys are so loving and welcoming and giving and thoughtful, and I rush to every event you all create. So we love Casey Circle very much.
Thank you. That makes my heart very happy, and we love the families we support. So I'm thrilled to get to know a little bit more about you and Hendrix, and I just thank you. I really appreciate it. Thank you so much.